Delay. Thank you for joining Advocates for Ohio's Future for a state budget webinar about public transportation in Ohio. Today we're going to hear from issue experts about the need for public transit and transit alternatives, opportunities and challenges in the state budget, how new health and human services initiatives will impact transportation, and what changes at the federal level could mean for Ohio. If you've never been on a webinar with Advocates for Ohio's Future before, I want to share a bit about who we are. We are a statewide coalition of over 485 organizations and thousands of individual advocates like you who focus on making Ohio a great place to live and work. That means we focus on policies that help Ohioans participate in the economy, be healthy and safe in their communities, and afford the basics like food, housing, healthcare, and transportation. After the webinar, you'll receive a follow-up email with the slides, a recording, and other resources. We will also include you on our email list going forward, where you will receive periodic email alerts, invitations to other webinars, and new resources that will help you advocate for good policy choices in Ohio. We hope that you'll continue to stay connected and advocate with us, but you'll have the opportunity to unsubscribe at any time using the link we include in every email. Today, you'll be hearing from three presenters about public transportation in Ohio. First, we have a change of presenters. We'll be hearing from Wendy Patton, who is a project director for Policy Matters Ohio. We'll also hear from Kirt Conrad, who is the president of the Ohio Public Transit Association. And finally, from Homer Carlisle, a professional staff member for ranking member of the U.S. Senate, Sherrod Brown. So without further ado, I will turn the presentation over to Wendy to get us started with an overview of what's happening in Ohio.
I want to hit it next, please. Good afternoon, and thank you so much for joining us in today's webinar on public transit in the Ohio budget. Policy Matters Ohio is a nonpartisan, not-for-profit research organization with a mission of contributing to a more prosperous, equitable, inclusive, and sustainable Ohio. We're a member of Ohioans for Transportation Equity, a coalition that includes transit agencies, transit unions, environmental community, persons with disabilities, the aging community. It's a broad coalition of many different people coming together to advocate for a 21st century transit system as part of Ohio's overall plan for mobility. A transit system which embraces alternatives in rail and freight, as well as in bus, in bikeable, walkable communities. And so in this budget, if you could advance it, we start out by noting that the reason that we came together and a major focus is that the state of Ohio's funding for public services is quite inadequate and has been for a long time. The state of Ohio ranks 44th amongst the state in the amount of money that it puts into public transit purposes. That's about 63 cents per person, which leaves us down close to the investment made by rural South Dakota. You know, by contrast, Ohio is an urban, densely populated state. Other states do much better. Michigan puts in $200 million a year. Minnesota, $340 million. Pennsylvania, $846 million a year. We put in about, in the budget for 2018 and 2019, the proposal is $40 million a year, and that's more than we spent in the last biennial budget. So we're doing a little bit better, but we have a little bit further to go. In 2015, the Ohio Department of Transportation, or ODOT, called for and carried out a really remarkable study, the Transit Needs Study, which called for much greater state investment in public transportation. They identified that the state puts about 1 to 2% of their funding into public transit, but it should be a much greater percentage. The state should be contributing 10% to overall transit uses. The public transit study called for the state to put in $120 million a year in 2015, a sum that rises to $185 million by 2025. And yet when transit agencies, when public transit comes out of the biennial budget for 2018 and 2019, they fall off the cliff. They come out with less money than they had going in. And the primary reason, how do you move this? The primary reason that they lose money is that they are losing a big chunk of money from the local sales taxes that they piggyback on the state base. This year, the state is removing Medicaid managed care services from the sales tax base. They're narrowing the sales tax base. Counties and transit agencies piggyback a sales tax onto a local sales tax onto the state sales tax base. So when the state narrowed the sales tax base, transit agencies and counties lose a lot of money. If you look on the chart on your screen, you'll see, for instance, that the transit agency in Youngstown they get initial transitional aid. They got, on average, they were making about $887,442 as a result of the sales tax that was the piggyback sales tax. This was from the MCO tax revenues. All of that money goes away. They do get some transitional aid in 2018, and we're grateful for that. But by 2019, that almost $900,000 is gone from the budget, and it doesn't reappear. If you go, you see Greater Dayton Regional Transit Authority loses about $4 million. Cleveland Regional Transit Authority about $20 million. After transitional aid vanishes by 2019, all of these transit agencies you see here lose all of the money in that first column. There is transitional aid in the 2018 budget, but you can see by the red numbers that not everybody is made whole. The Stark Area Regional Transit Authority, for example, got more than $1 million from the MCO tax revenues and the sales tax. And although they do get some transitional aid, they lose about $300,000 in this year. So we are already losing money from the public transit budget, even going into the biennium, and we fall off the cliff at the end of the biennium. Ohio's investment in general revenue funds has fallen steeply over time when it comes to funding transit. You'll see in this chart that the gray line that this drops off the cliff in the early 2000s has not been restored. And so at one time, public transit got more than $40,000 a year out of the general revenue fund. By now, we're seeing our general revenue fund provide only about $7.3 million, which is inadequate to meet needs. We are asking that the state invest more in public transit, and there's a number of critical reasons why we are asking for a greater investment in transit. Number one, many people lack cars. The transit needs study let us know that almost half of the people who ride the bus don't have an alternative. They don't have cars. People with disabilities need transit options. Members of the Ohio Transportation Equity Coalition point out that across the community of people with disabilities, employment is much lower than in the general population, and one of the leading reasons is a lack of options to get to work. Seniors stop driving and need options for getting around as well. Increasingly, jobs are growing on the urban perimeters while people live still at the urban core. Workers need a ride to work, and employers need a regional labor pool to draw on. Public transit is the link between job seekers and employers. Younger people want transportation options, Folks like to live in a walkable area downtown. They want to be able to take the bus around. They want to be able to bike around safely. And finally, public transit deserves a significant place at the Ohio transportation or mobility table because it can ease congestion, mitigate air pollution, and reduce wear and tear on roads. It's an integral part of a transportation plan. Now we have, by now we've been working with the General Assembly for the last month or two, and the Ohioans for transportation equity remain firm in their support of a commitment for $120 million a year. This is 10% of the ODOT Flexible Highway Funds budget. This money would be made up, the request for $120 million a year would be made up through both state GRF funds and also through federal funds that are typically used for highway construction, but it may be used also for public transit. This chart shows that Ohio has used significant amounts of federal highway funds for public transit in the past, in 2011, but we've sort of leveled off in the last few years. Now, Policy Matters Ohio and the Greater Ohio Policy Center and others are urging legislators in the current budget to fund, to provide $50 million a year from the federal highway funds budget in the ODOT budget. They're putting in $33 million a year. That's good. It's about $10 million a year more than we got last year, but it's not getting us close enough to the 10% of the overall budget. Now, yesterday we were gratified to learn that the Senate has put in some one-time funding into the ODOT budget for highway transit, an additional $15 million a year. If that stays in the budget and if it's not knocked out by conference committee or by veto, that means in the ODOT budget we would be seeing about $48 million a year during the next biennial budget, which is great. It gets us very close to that goal. We're very grateful for that. And I just want to finish up, Rebecca, if you'd go back, and I'll turn it over to Kirt. We are also suggesting that there be additional funding through the General Revenue Fund that allows, provides a match for small towns and rural places to be able to draw down federal funds on their own to replace an obsolete stock of vehicles in the state. So we are asking also that the state consider putting additional general revenue fund into the operating budget. Policy Matters Ohio is requesting $25 million. And then we're asking for a sustainable source of revenues to replace what is being lost as the sales tax was narrowed. That represents a loss of about $40 million a year to public transit. So even though we're, at this point we're seeing about if what the Senate has suggested should go into the budget, if that goes through, we're seeing at this point that we might have a budget of maybe up to $52 or $53 million a year. But on the other hand, remember, we're losing $40 million for public transit because of the narrowing of the sales tax base and the loss of local sales tax revenues. So we continue to fight during this budget season for adequate funding for public transit. And now I will turn it over to our next presenter, Kirt Conrad, the president of the Ohio Public Transit Association.
Well, thank you for that introduction. Besides being the head of the Ohio Public Transit Association, I'm also CEO of the Stark Area Regional Transit Authority. One of the things Wendy wanted me to talk about was in the budget. One of the things that the governor has talked about pretty significantly is trying to use some type of innovation and new technology to improve transportation of those seeking health services. These quotes here are actually coming out of some of the state budget itself. If you look at how much money the state spends on transportation through the 14 different departments across the state, there's almost $500 million a year that's being spent for transportation through Medicaid. And a number of transit systems actually do provide non-emergency medical transportation contracted at the local level. Greg Moody, the director of the Office of Health Transformation, is actually the agency that controls Medicaid at the state level. What he would like to do is centralize non-emergency medical transportation for those on Medicaid. We as OPTA have met with the Office of Healthcare Transformation in trying to understand exactly what that means for transit and the transit systems. One of the things they would like to do is actually work closer with us in trying to deliver that Medicaid transportation. Right now, the counties are this program is administrated on the county basis through the county jobs and Department of Jobs and the Department of Jobs and Family Services at the local level. Director Moody did believe, and some of this does actually happen, it causes confusion, and sometimes the individuals have to change providers, and it does cause for not only for confusion, but it also provides for duplication of services at the local level, because there's really not a clearinghouse for those trips that are being provided by a multitude of providers on a local level. One of the things we've been advocating for in the transit industry is brokering those trips through a centralized brokerage system like a transit system to try to make sure that you don't have several vehicles going to the same place and transporting people to the same place, so we can have higher efficiencies and more coordination. Right now, what the state has proposed is looking at doing is standardizing companies and also standardizing requirements. One of the interesting things across all state agencies, each agency sets their own standards for how things are going to work. Interestingly enough, whenever the Stark Area RTA actually became a Medicaid provider under the Ohio Department of Developmental Disabilities, I literally had to provide the state my high school diploma. I'm not sure why. I guess they want to make sure I graduated from high school. But some of those requirements across the different departments, sometimes we have to have first aid kits. Sometimes we have to have operators with CPR training. Sometimes we have to have criminal background checks of operators, including fingerprints. So one of the things, and I do think that the state wants to try to break down some of those barriers to try to eliminate duplication and barriers that's at the state level. The other thing too is the state actually wants to, on a regional basis, go to some type of brokering system, so that there may be multiple counties where an entity is actually brokering these trips to assume, one, the medical destination is actually something that's needed and there's no duplication on that side, so you're not driving 3 or 4 counties away to get a primary care physician visit. Some of the other issues that they want to make sure is that within each of those counties that have fixed routes, that they are transporting them. The one thing, I'll go back here. The one thing that the question is it going to be a public provider broker or a private sector provider broker? And I believe at this point in time, the way that the state wants to go is somehow have it be a public sector broker. We as the OPTA, the State Transit Association, we have been advocating that transit systems actually have the ability to do this. They seem to be open to it and actually somewhat supportive of it. And if we can actually start the transit systems being brokers, we can more efficiently, ensure that the Medicaid transportation being provided by transit systems is maximized, potentially having the revenue stream for the transit systems that's losing so much money, as was outlined before, but also provide better service overall. And so with that, that concludes my remarks, and I'll turn it over to the next speaker.
Well, Kurt, thank you very much. This is Homer Carlisle. I work for Senator Sherrod Brown. I will just go ahead and I have to get one little bit of business off to start, which is please consider my remarks today in today's webinar to be off the record, and nothing I say should be attributed in any reporting. The opinions I express are my own and don't necessarily reflect the views of Senator Brown. If any reporter who's on the webinar would like to obtain a statement from the Senator, our office would be happy to provide contact information for our communication staff so that you can get a statement. Thank you. That's just something that congressional staff and from our office will say whenever we're presenting publicly, because as I just said, the opinions I express are my own, not necessarily those of Senator Brown. You always want to make a chance for the senator to make sure that he says exactly what his position on things would be. But that said, I really appreciate the opportunity to be on today's webinar to talk about public transportation and talk about how Senator Brown is working to advance the issue of infrastructure and transit investment. You may be wondering why my title is for the Senate. Is from the Senate Banking, Housing, and Urban Affairs Committee. In the world of the Senate, we split up the jurisdiction on infrastructure and transportation issues between several committees. And the Senate Banking Committee has overseen investment in public transportation since the federal government first started providing transit grants back in the 1960s. Senator Brown became the top Democrat on the committee for banking 2 years ago, and so when he took on that role, he also took on the role of being the top Democrat for overseeing transit and the Federal Transit Administration. And he's really tried to use that role to do as much as possible to advance transit investment. I think his biggest accomplishment would have been the 5-year highway and transit authorization bill that was enacted 2 years ago. Senator Brown led the fight to make sure that public transportation received at least 20% of the federal funding, which is the traditional benchmark, and he actually succeeded in getting a little bit more than traditionally has been allocated for transit. We ended up with a multi-year authorization bill. It's called the FAST Act, and it gave us a pretty close to 21% of federal funding for transit between the highways and transit. So that's just kind of the example of the advocacy that Senator Brown's been working towards. But the subject for today is really where is Congress going with regard to infrastructure, and there's been a lot of attention to infrastructure as a result of the past presidential campaign and promises by both the Democrat candidate, Secretary Clinton, and the president, now President Trump, to deliver on infrastructure. President Trump's promises on infrastructure were very explicit and very direct. He talked a lot about wanting to do a $1 trillion investment in infrastructure. On my slide there, you can see just a few of his promises, talking about fixing inner cities, rebuilding highways, replacing obsolete trains. But the biggest promise, of course, was the fact that he wants to spend $1 trillion on infrastructure. So what does that $1 trillion mean? And because that's a really important question. Well, as you can see from the slide, this is from the New York Times, maybe about a couple weeks ago. It is a mystery exactly what President Trump is planning to propose on infrastructure. During the campaign, a couple of his advisors, including Wilbur Ross, who's now the Secretary of Commerce, put out a paper suggesting that the $1 trillion of infrastructure could be really put together through a large package of tax credits for public-private partnerships. Well, that is a pretty controversial and potentially disturbing proposal because, for the most part, public-private partnerships really only work for large-scale projects that return revenue. An example would be something like a toll road or a new bridge. That's the kind of project that you can bring in private investors to help fund it and operate the project, but of course those private investors are going to want a return back on their investment, and that means it has to be paid back with tolls or user charges. So while it's one thing to suggest that we might do more at the federal level to encourage private investment in infrastructure, it's also a scary proposition to think that that would be the only thing that the federal government does to try to encourage infrastructure, or public-private partnerships or tax credits would be the only thing to try to spur $1 trillion of investment. Because if you look at most nonpartisan analysis of projects, they are going to need real direct federal investment if we're going to make progress on our nation's large deficit of infrastructure needs. Beyond just the issue of this, would an infrastructure package be made up of private investment? There's also the issue of when exactly is the president going to try to bring forward a plan? Just before I got on the webinar this afternoon, there's an article in USA Today from Secretary Transportation Elaine Chao saying that the president's infrastructure package might not come out till this fall. So while this is one of the few areas in Congress where there is some bipartisan agreement that we need to work on infrastructure, it's going to be, we may have to wait a while until we actually see what President Trump and others want to do on infrastructure. So to contrast that, though, Senator Brown, my boss, along with the Democratic leader, Chuck Schumer, and the other top Democrats on the committees that handle infrastructure, Senator Carper, who handles highways at the Environment and Public Works Committee, Senator Nelson from Florida, who oversees railroads and aviation at the Senate Commerce Committee, along with our Budget Committee Chair, Bernie Sanders, and a couple others. They came together at the very beginning of the new Congress in January to say that Senate Democrats strongly believe that President Trump should try to live up to his promise of wanting to deliver a $1 trillion package of investment in American infrastructure. And so to try to urge the president and show a path towards that goal, Senate Democrats came together with a blueprint to rebuild America's infrastructure. And so the slides here are just a couple highlights of the infrastructure areas in the Senate Democratic blueprint. And when Senator Brown and the other Democrats came together to put together this package, they wanted to frame this as a 10-year plan for direct investment in American infrastructure. They wanted to highlight the wide range of sectors that need investment to overcome the bad condition of many infrastructure areas. So just for a few examples here, there's, in addition to we've got $210 billion for roads and bridges, $110 billion to modernize water and sewer systems, $180 billion to basically repair public transportation and expand our intercity rail system, and then $200 billion for mega projects and significant projects of regional and national significance. And the list goes on. I can send out a more detailed summary of the Democratic infrastructure blueprint, but it was meant to cover a broad scope of infrastructure sectors. As you can see up there, schools are covered. There's also funding for energy infrastructure, ports, and as well, another area which our committee covers is housing infrastructure. The blueprint also covers funds to renovate public housing and address issues of public health concerns, such as removing lead from housing infrastructure. But subject, of course, today is public transportation, and so the Democratic blueprint suggested $130 billion of infrastructure investment just for public transportation. And this investment was intended to overcome a large number of the needs that we know are out there for the transit sector. First off, you can see the D-. That's the report card grade that the American Society of Civil Engineers recently put out as part of their 2017 infrastructure report card. Of all the different sectors of infrastructure, ASCE rated transit as D-, which was the absolute lowest sector. So everything else, highways, airports, water, ports, bridges, all received a better grade than transit. We also know there's about a $90 billion maintenance backlog. That is actually not done by ASCE. That is a statistic that the U.S. Department of Transportation produces by looking at the reports that every transit agency sends to DOT. And that basically means that, in addition to all the money being spent on transit service and transit repairs today, we would need another $90 billion up front in order to really bring all the transit systems up to a state of good repair. To give you some perspective of what that would mean, nationally, for example, we need to replace about 46,000 buses and 8,000 rail cars in the next 10 years. And in Ohio, that drawing from the same statistics, the state has about 2,500 buses, and in the next 10 years, we're going to need to replace about 1,500 of them. So, the cost, when you're looking at a bus that can cost anywhere from, $400,000 to, upwards of $800,000 or $1 million if you're buying a new electric bus, these are some serious expenses, and it's going to take some real concentrated effort, both at the federal and state level, to make those investments that can really advance transit and make sure that as many Ohioans and Americans have access to good transit services. Now, before we can, Congress gets to considering an infrastructure package, though, there's also going to be some of the regular budget process for the annual appropriations bills. And you might have read in the newspaper about the Trump administration's budget that was released. What they put out last week was called the skinny budget, which means it was just some real top-line proposals for the appropriations process for the next year. And it was, frankly, a little bit disappointing that the president's first budget blueprint actually proposed cutting a number of important infrastructure programs. What's on that slide now is just some of the highlights. Basically, the president proposed eventually phasing out the Federal Transit Administration's capital investment program. That is the program that provides funding for the construction and expansion of subways, light rails, bus rapid transit systems. So it's really about capacity and construction. Ohio does not have any projects currently under construction or projects that are close to getting a construction grant, so no Ohio funds are at risk. But that's the program that our cities would look to in the future to try to build new rail systems or expand rail or expand bus rapid transit like the CMAX in Columbus that's being built. So it's really a shame that the new administration is choosing to propose to wind down some programs and instead of trying to focus on expanding them. Similarly, the skinny budget that just came out suggests the elimination of all of Amtrak's long-distance routes, which would result in cutting all 3 of the routes that go through Ohio. And finally, the administration proposes eliminating the Tiger program, which is a multimodal competitive program and has been extremely successful in providing grants to communities around the nation for innovative projects. Again, this is just the initial budget proposal, and Congress will work through this. And in fact, Congress eventually may disregard all of these proposals and focus on a really healthy package of infrastructure investments. But again, it's disappointing that the administration chose to suggest eliminating some infrastructure programs instead of trying to focus immediately on a larger package. So what's the path forward? As I said before, we may be waiting for a little while to see when the president will release an infrastructure package. But in the meantime, I think Senator Brown has been working and traveling around the state talking about opportunities for infrastructure investment. There's a quote up here that he offered at an event in Cleveland earlier this week. And, he'll be working to try to build bridges with offices across the aisle and looking for opportunities to encourage that real direct investment in infrastructure. And once we do see a plan from the administration, I think Senator Brown will look at a plan and try to decide if it's a good deal for Ohio and want to see if it's a good deal for transit interest and make sure that it has a good balance between highway and transit investment. And most importantly, Senator Brown's going to be working with the President and others to make sure that we do try to invest as much as we can toward that goal of $1 trillion of direct investment. So I'll just pause there and happy to take any questions.
All right, thanks. Before we move on to questions, I just wanted to share with you a couple of next steps, what you can do after the webinar. So as I mentioned, you will receive a follow-up email with the details from today's webinar, and will be included on AOS email list going forward, so you will get all of our advocacy opportunities. I've also given you a couple ways to get connected with our presenters as well as Advocates for Ohio's Future. These links to our Facebook and Twitter pages are live, so if you click them, you can open a tab and start following us on Facebook and Twitter now to help us share information with your network and hopefully some new advocates who are interested in increasing access to not only public transportation but other vital human services programs in Ohio. We also encourage you to spread the word about the need for increased access to public transit and transit alternatives in Ohio. I am happy to announce that we have new state budget issue fact sheets that provide background on a number of human services issue areas, including transportation, and also highlight how targeted state investments in these public services and supports strengthen Ohio's families and communities. Again, these links are also live, so if you're interested in taking a closer look, I know this is a little small, you can click it and it'll pull it up in a new tab for you. All right, so thank you to Wendy, Kirt, and Homer. At this point, we will open it up to questions, not only in the chat bar, but also with audio. So if you give me just one moment, I will change the mode for it so that you can unmute your phone.
All attendees are muted and may unmute themselves by pressing *6.
All right, so we did have a couple of questions, and presenters feel free to answer as you feel able. How much did Medicaid expansion impact Medicaid transportation budget?
Kirt, do you have an answer for that? I don't.
Yeah, there was an expansion. I can't tell you exactly the number, just because they're required to provide transportation for every person that was on Medicare to make sure they got to their appointment. So there was an expansion, and I can give you the exact number.
We do know that the Medicaid expansion expanded Medicaid by now it's by about 700,000 people. And so we imagined that there was some impact on the Medicaid transportation budget. We know that the average age was about 40. It was younger than some of the folks within the Medicaid program who rely heavily on transportation. If we can get hold of that number, we'll get it to you. We'll make a note of your name and find an email for you.
All right, next question. Will there be medical transportation for non-Medicaid citizens?
That is a question that I'm not aware of an answer. I'm not aware of a proposal on the table for specific medical transportation for non-Medicaid citizens. There is, however, transportation-related funding related to programs outside of Medicaid for various health and human service programs that are not part of Medicaid. And it's my understanding that those programs will also be included in the brokerage system that Mr. Conrad described. And so we hope to see transportation systems across Ohio's health and human services better coordinated and better for folks who use it.
All right, do we have any other questions? All right. Well, thank you again to all of our speakers for giving us a better understanding of where we're at with public transportation in Ohio and opportunities for us to improve. I also want to thank all of you for joining us today. I'm glad that you're here listening. And as you plan to learn about new issues and advocate with us, I hope that you'll consider making a donation to help us continue to offer great webinars and more information and resources like this to you and advocates in the future. Through a matching campaign with the George Gunn Foundation, your donation will have an even bigger impact as it'll be matched dollar for dollar. So that means $5 will become 10, 10 becomes 20, etc., all up to $10,000. So thank you again, and I hope that we'll see you all soon on our next webinar.